name is Dr. Christopher Costa from Platinum Plastic Surgery, and today we are talking about post-op recovery and instructions after rhinoplasty surgery. This is going to be applied specifically for my office. Your surgeon may do something different. Immediately after surgery, you can expect to have a splint over the top of the nose. That is meant to kind of keep everything in place and help decrease swelling, along with some tapes over the nose. And then usually there's an incision line that is right on the base and maybe some around the sides, depending on the extent of the procedure that we had to do. You can expect all of that to stay in place for 1 week. You may have some light bruising, like around the eyes. Over 90% of my patients, when I see them at 1 week, don't really have any bruising, maybe just some light swelling around the eyes. So typically bruising is not a big issue. At 1 week, we will remove the splint, the tape, the sutures, and you'll see what your new nose looks like. You'll see that the hump's been removed, you'll see that the tip looks smaller or elevated, or whatever it was that we had talked about. However, the nose may look a little bit wide and the tip may look a little large, and that's because we expect you to have a lot of swelling even after that first week. The first 6 weeks after your surgery, you are going to have some swelling, and it's going to take time for that swelling to come down. Preference is that you do not really touch your nose out, sort of just some light, gentle touch. Treat your new nose like a piece of artwork, so look, don't touch. It's kind of the mantra for at least the first 6 weeks, and the reason why is because all of the underlying structures are still settling and healing into place, and in theory, any sort of like aggressive pressure on the nose or pushing on the nose, sleeping on your stomach, you can shift the result. So first 6 weeks, just really don't touch anything. After 6 weeks, I usually start doing some training the patients on how to do some lymphatic massage to help decrease the swelling, because you can start being I think a little bit more aggressive at that point. You can expect about 75% of your swelling to be gone within the first 3 months, and really you'll lose a lot of that swelling even in the first 3 to 6 weeks. That last 20-25% of that swelling usually takes about a year to fully come down. Every month your nose is just going to look better and better kind of as the swelling comes down. Swelling can come down asymmetrically, meaning one side can stay a little bit more swollen than the other. The result of that is it can actually make the nose look like it's healing crooked or something like that. It's good to know that ahead of time, because it will heal fine as the swelling comes down almost every single time. Most of the time that asymmetric swelling, as it comes down, everything looks good and straight, because remember, internally all the strength and support was done to make the nose straight. The biggest complaint that people have after a rhinoplasty procedure, it's not really pain, it's not waking up in a lot of pain. It's really just that feeling of stuffiness, that you can't breathe through your nose. You gotta breathe through your mouth. And we do give you some pain medication to take if you need it. Most of our patients don't take any medication at all for pain after the surgery, except for over-the-counter ibuprofen and Tylenol. It's also normal to have a little bit of a headache from the anesthesia, or a kind of a sinus headache, just feeling that pressure. So over-the-counter stuff, and then you have something available if you need it for something stronger. There are a couple sprays that I recommend everyone buy that are just over-the-counter before their rhinoplasty surgery. One is a regular nasal saline spray. The saline spray is really good for just kind of washing out the nose, especially if immediately after surgery you've got some scabbing or clotting and you feel like it's really hard to breathe. You can use that saline spray to just irrigate the area and kind of loosen some of that up. The second thing is Afrin. Afrin can help open up the airways, although my recommendation is really to just have that as a standby medication in case you get a nosebleed. You can always spray some Afrin up your nostril. It can help decrease the bleeding. Other things I recommend are just having some regular gauze to catch if there's any dripping in the first 24 hours, allergy medication, that kind of thing, and then over-the-counter ibuprofen and Tylenol. Other things to cover before your rhinoplasty surgery. Absolutely no smoking, no nicotine use. Nicotine in wound healing are absolute contraindications, so no smoking. I like my patients before rhinoplasty to be off any nicotine for at least 2 weeks. The next thing to talk about is going to be diet and activity. So from a diet standpoint, leading up to surgery, probably increase your protein intake do all the things that essentially they tell you to do, like if you are going to the gym, lots of green leafy vegetables, that kind of thing, help bump your hemoglobin up, and that also just helps with wound healing. After surgery, I don't have any eating restrictions. You can eat whatever you want. When it comes to swelling and decreasing your swelling, that sodium does play a big part in that. So having like a low sodium diet and avoiding like processed foods or like those frozen meals, it really does help decrease your swelling. Talking next about like activity after surgery, I really recommend trying to sleep the first 2 weeks with your head elevated. Think of like sleeping in a recliner. Some people, that's really, really difficult to do, but it really does help. So gravity can be either your friend or your worst enemy. So if you're lying flat, every morning you wake up, you're gonna have more swelling. It's going to take your swelling longer to come down, and it can even lead to a little bit of discomfort. Whereas sleeping more upright, you're using gravity now more to your advantage, and you're bringing some of that fluid out of the upper part of your head, which will help get your swelling down faster. For the first week while you're recovering, take it easy. I have had patients literally go back to work like 2 days after surgery because they just have like desk jobs and they don't care that people see their splints and that kind of thing. But for the most part, I say like take a week off from work. It's important to be up walking every 4 hours, so you shouldn't be like bedbound or anything, but nothing that's going to get your heart rate over 100. I let you kind of go back to normal activity after 2 weeks. At a week when your splint comes off, you can pretty much go back to normal activity minus like really, really heavy weightlifting. And that I like you to wait like 2 to 3 weeks. Incision care. It's very important after these stitches are removed that you're very, very careful with that incision, because it's only been healing for a week and can still break open if you're cleaning it too aggressively or that kind of thing. So we recommend kind of leaving the area alone. If there's even a little scab, you can gently treat the area with some half-strength hydrogen peroxide. Other than that, we say like just essentially don't mess with your incision. It's going to heal great. I'd say over 90% of the incisions, you can't even see them after a year. Cleaning the nose after surgery, it's very normal to have some black looking blood clot in the nostrils, like clogging the nostrils, or maybe even like around the incision. The first 24 hours, you may even have like a little bit of drainage from the nose. So we'll put like a little drip pad under the nostrils. After the nose has stopped draining, you can take that off, just leave the splint on with the stitches. And then when it comes to that clot that's in the nostrils, I don't want you like blowing your nose or like really pushing hard, because that can spike your blood pressure up and lead to bleeding. So what I recommend is just use some regular over-the-counter hydrogen peroxide, and you're going to mix it with some just regular tap water at a 1:1. So 1 teaspoon, mix it together so it's like half strength. Then you can use the edge of a Q-tip, just get it wet in there and just gently go around the nostrils with the Q-tip. That will actually do an awesome job of kind of dissolving that clot or that scab and making it so it loosens that tissue up. And then you can spray some of the saline spray in there to kind of irrigate it out and gently get anything that's obstructing out of the way. Standard emergencies for anything after surgery would be if you have a fever greater than 101.5, if you start experiencing some uncontrollable bleeding like through the nose, increase in pain a couple days after surgery. Those would be reasons like definitely to call our office or come see us. We may even recommend going into the ER if we're not able to help you immediately. Alright guys, thanks for watching our video. If you have more questions about this procedure or any of the surgeries I perform, check out my website, drcosta.com. We'll put a link in the description below. If you like this video, please like and subscribe. We're trying to produce a lot of these to get the public more information about plastic surgery.